human lungs. What are the lungs? The human lungs are a spongy pair of air-filled organs inside of the human body. They can be located on either side of the heart in the upper part of the torso. The trachea, also known as the windpipe, carries the air inhaled by the human down into the lungs via the bronchi, which then subdivide into the bronchioles, which are tiny at a microscopic level. This is then fed to the heart so that it is able to pump the oxygenated blood throughout the body. Anatomy and physiology. The only purpose of the lungs is to suck oxygen out of the air, out of the atmosphere, so that the body is able to complete the respiration cycle and then release carbon dioxide back into the atmosphere. In order for the lungs to properly function, assistance is required from various structures outside of the lungs, such as the muscles from the diaphragm, the intercostal muscles, which can be located between the ribs, the muscles from the abdomen, and even in some cases, the muscles in the neck, though the diaphragm does the majority of the heavy lifting when it comes to assisting the lungs with breathing. Common diseases and infections. The three most common lung infections and diseases include asthma, acute bronchitis, and cystic fibrosis. Asthma. Asthma is the most common problem with the lungs. It is a condition where the airway inside of an individual's lungs will become quite swollen and narrow. This restricts breathing capabilities and, if left untreated for too long at each time, can result in death, though the severity of asthma attacks varies from person to person. Common symptoms of asthma include wheezing, coughing, difficulty breathing, and breathlessness. Asthma attacks can be triggered by allergic reactions, strenuous physical activity, or large amounts of foreign chemicals in the air, such as smoke or deodorant. Asthma is most commonly battled using all-day prevention drugs such as montelukast and Singulair. However, in the event of an asthma attack, the most common defense is an inhaler or puffer, which provides immediate relief to the airway. Bronchitis. This is the inflammation of the larger airways in your lungs, usually because of infection by a virus. The inflammation causes you to cough. Sometimes the inflammation is caused by bacteria or breathing in smoke or dust, but most commonly caused by smoking. Common symptoms of bronchitis are coughing or wheezing, either dry or bringing up phlegm, aches and pains in the throat, fever, shortness of breath, or feeling tight in the chest. The most common approaches to curing bronchitis are inhaling steam or having a warm bath, avoiding cigarette smoke and other irritants, drinking plenty of water, simple pain relief medication such as paracetamol, or a teaspoon of honey at night, either by itself or in warm water. Cystic fibrosis. Cystic fibrosis is a hereditary disease where the lungs and stomach become clogged with mucus. At the moment, there is no cure for cystic fibrosis, and there are minimal treatment options to handle it. One treatment to keep the mucus production under control is to heavily control your diet. Favor foods that are high in protein and zinc, as this helps prevent muscle loss or damage, as well as staving off lung infections, which are quite common to people diagnosed with cystic fibrosis. Medication that you can be given to reduce the effects of CF are mainly antibiotics and anti-inflammatory, as to reduce the swelling in the lungs and to reduce the risk of serious lung and chest infections. Though mucus thinners and bronchodilators are also administered to make the removal of mucus much easier. Transplants and operations. The most common reason for a lung transplant is chronic obstructive pulmonary disease, or COPD. This is when a combination of lung infections and diseases start to completely seal off the airway, making it harder and harder to breathe properly. If the disease begins to reach its worst stages, then a lung transplant is typically required, as the old one becomes completely blocked and inoperable. Another common reason for lung transplants is lung cancer, which can be caused by any number of causes, but consistently it is smoking and vaping. There are two types of lung transplant. The first is a single lung transplant where only one lung is replaced. This is completed via an incision on one side of the chest, depending on which lung is being replaced. And the second is a double lung transplant. This is when both lungs are taken out and replaced with new donor lungs at the same time. This is performed via either one incision on either side of the chest, or one large incision across the entire span of the chest for ease of access. So some transplant statistics. For the majority of people, the waiting list for a lung transplant is 2 to 3 years, due to the low number of donors within Australia. As it is such an invasive procedure into the body where two of the most vital organs are being removed and replaced, the survival rates are not as strong as with other transplants. Out of all lung transplants, only 78% of most patients will survive their first year post-op. Of that 78%, only 63% will survive 3 years post-op. Then of that 63%, only 50% of them will survive for the next 5 years. The low survival rate is caused by the immune system identifying the foreign object and immediately trying to remove it from the body. As the lungs are such a large and vital organ, immune suppressants are not as effective as they are with the kidney or the liver, which means there is a much lower survival rate for lung transplants. Other relative information includes, at the moment, most lung transplants are not typically seen as an effective long-term solution. This is due to solution to respiratory problems, as they are only able to extend your life for a short period in most cases. Due to this problem, many people are looking at other treatment solutions, such as cellular therapy. Cellular therapy is when a healthy cell, also known as an autologous cell, is extracted from a healthy part of the body, typically bone marrow, tissue, or blood. It is then separated from everything until it is just a single cell, where it is inserted in the damaged area as a replacement to the unhealthy cell. From there, the cell is meant to multiply, removing all the other affected cells and replacing them with the healthy ones. This treatment method is still in its early stages and is not always successful, though in some tests it has been known to cure cystic fibrosis partially or completely. Further study is being done on this treatment method to make it more effective on patients. Thank you very much for watching this speech today.